Today I am reading Medicine Ringworm. Ringworm from book Soul of Remedy, book written by Dr.Rajan Sankaran. Ringworm is a no-soul, the central point of ringworm miasm. This miasm lies between the sora and psychosis. It is characterized by an element of struggle as well as a resigned acceptance. The nosode was prepared from scraping of the eruptions of tinea taken from an infected patient. Histopathological examination of the scraping confirmed it to be a tinea. I conducted a proving of this nosodes. From result of proving as well as from the patient that I have treated with ringworm, I have understood the main feeling of this nosodes to be that the task at hand is just beyond where the person can be sure of success. The main action of the prover or the patient is that for trying to do something, trying to accomplish a task. He starts with a kind of lack of confidence, become a hopeful, tries to accomplish the task and struggle at it. At some point, however, he decides that it is not going to work, that he will not be able to accomplish the task by this method, that is the beyond his reach. So he give up and accept that he has to live with it. As a result, he doesn't anything for quite some time. After a while, however, another possibility seems to open up for him and become a hopeful once again. He starts trying and struggling all over again, only to give it up after realizing that it is the beyond him. So there is an alternation between the struggling and trying, and then giving up, between hopefulness and resignations. I have found that in the dream of most of brewers as well as in the lives of most of the patient, one can see an alternation of this struggle with the period of inertia where it is trying to reach college on time, trying to give up smoking, trying to get rid of the illness or trying to build a relationship. A typical example would be the struggle of an obese person trying to lose weight. There are period of jogging, walking, dieting, struggling, followed by the period of indolence, calorie, chocolates. This is acceptance. The dream of one of the poor is worth nothing. He dreamed that he was inside a tent and was trying to come out. But outside the tent were thousands of crows that picked at him each time they go out. So he had to get back in again. He would try repeatedly to come out, but each time he would have to give up and go back inside. This dream clearly brings out the alternation between the struggle and the resignation. Other prover had a dream with similar themes for detail of proving of ringworm. I refer the reader to my book, The Substance of Homeopathy. I have seen this. I have seen that these patients generally lack confidence. There can be egoistic talk like a sulfur, or on the other hand, a cover up like a Madurina. There can be anxiety attack as well. But the pathology and symptom all come and go in a phase. There is often a history of fungal infection, either in the groin or in between the toes, with period of terrible, intolerable itching, alternating with the period of absolutely no itching whatsoever. The symptoms never really become acute or destructive, and the person feels that he will have to live with this problem, although it would be better to try and get rid of it. He struggles periodically, but when he fails, he just accepts it. The remedy that comes closer are calcarea sulfurica, magnesium sulfurica, and calcarea salicylica. This is all about ringworm remedy.